We waiting for you. Okay, we're about to get started. Good afternoon. My name is Ambrose Lane Jr., and I'm chair of the Health Alliance Network and chair of the Opioid Solutions Working Group. In May of 2021, the Health Alliance Network formed the Opioid Solutions Working Group with community partners and those that provide services in the opioid space. Since that time, we have crafted resolutions to advisory neighborhood commissions in wards 7 and 8, civic associations on the issue of opioids and how it has been detrimental to our communities. We're here today to call on the mayor to issue a public health emergency on opioids. Why does DC need an opioid public health emergency? Last week on April 3rd and 4th, DC Health issued an opioid spike report. There were 24 overdoses in 24 hours. They were mainly in wards 5, 7, and 8. The most recent CDC numbers now lift DC to the #1 spot in the United States for all overdose deaths, rising above West Virginia. 2022 saw increased opioid deaths in the under 16, the 20 to 29, the 30 to 39, the 40 to 49, and 50 to 59 age groups higher than ever before in 1 year. There is a national public health emergency on opioids, a Virginia public health emergency on opioids, and a Maryland public health emergency on opioids, but not in the District of Columbia. And DC does not have an adequate infrastructure or ecosystem or workforce to seriously address substance and opioid use disorder, and we are losing the battle. Opioid deaths have risen every year since 2018 and was higher in 2017 in wards 4, 5, 6, 7, and 8 than in 2018 or 2019 in those same wards. The opioid death totals over the last 6 years have more than doubled homicides. From 2017 to 2022, there have been 903 homicides, but 2,061 opioid overdose deaths. From March 2020 to December 31st, 2022, there have been 1,411 COVID deaths, which is an average of 41.5 average deaths per month. For the same period of time, there have been 1,219 opioid deaths, an average of 35.8 deaths per month. The opioid crisis is almost as bad as the COVID crisis from March of 2020. The CDC ranks DC #1 in all drug overdoses and #2 in the US in all opioid overdose deaths per capita. This is a crisis. It's not about the mayor. It's not about the city council. It is about the District of Columbia. It is about our communities that are suffering because we have not put all of the resources that we can put in to address the opioid crisis. As I mentioned before, the opioid crisis is an epidemic almost as bad as the COVID crisis. It's much worse than the homicide crisis. For every homicide funeral procession that you see 2 or more opioid overdose death funeral processions. We have to address this issue, and we are calling on the mayor to issue a public health emergency. There are things that the mayor can do, and there are things that the council can do to address this crisis. The heat maps of gun violence and opioid use deaths are virtually the same. When you look at the heat maps that show where the gun violence is occurring in the district, in every ward, and you look at the maps where opioid deaths are occurring, they are the same maps. The introduction and proliferation of the drug xylazine with opioids creates a zombie-like effect that greatly exacerbates the crisis. There is no known antidote for xylazine. Opioids are increasingly being marketed to DC youth, as exemplified by increases in non-fatal overdoses among high school students, and in 2022, increased deaths under age 16. What can the DC Council do? The DC Council can first pass a resolution declaring that the current opioid crisis constitutes a public health emergency. They can pass the Prior Authorization Reform Act of 2023, eliminating prior authorization for MOUD treatment. They can accelerate the establishment of the Opioid Abatement Advisory Commission and amend legislation to include more community advocates. They can create an emergency fund of $35 to $50 million so that funding can take place for an adult 24-hour residential treatment facility that treats co-occurring disorders, a youth 24-hour residential treatment facility that treats co-occurring disorders, a SUD, OUD behavioral health urgent care center that addresses and reduces emergency room visits, which would save millions of dollars in hospital costs, and it also reduces criminal activity. It would also fund a harm reduction center east of the river for safe and monitored consumption, and it would allow for a fund extension of an on-demand substance use disorder and opioid use disorder care treatment to publicly funded group homes and halfway houses. Allocate $500,000 to each of the 4 DC prevention centers for extended outreach, education, and prevention. And the money from this, the financing, can come from projected savings from hospital admissions and readmissions, Housing Production Trust Fund, the Home Buyers Program, and the Opioid Settlement Funds. The Council can also require a report from Department of Healthcare Finance to identify and produce a substance use disorder workforce development plan with reimbursement rates that reflect equity. Workforce can also be financed through a second 1115 Medicaid waiver. The Council can also enact legislation requiring Department of Healthcare Finance to amend the managed care contracts to include creation of a required unified registry at a university hospital to track overdoses, treatment, etc. across all platforms of substance use disorder and opioid use disorder services. What can the mayor do? The mayor can issue an executive order for opioid public health emergency for 18 months. She can use eminent domain to secure designated sites for adult residential treatment, youth residential treatment, harm reduction centers, etc. The mayor can identify and publicly report all barriers that inhibit the District of Columbia from currently creating an SUD/OUD infrastructure to significantly reduce opioid deaths, repurpose unused and vacant properties for similar purposes, revise the Live Long DC program to reflect the public health emergency. She can also accelerate establishment of an opioid abatement advisory commission and amend that legislation to include more community advocates. She can also identify budget allocation of $35 to $50 million from various sources to fund initial infrastructure initiatives. Direct Department of Healthcare Finance to initiate a second 1115 waiver to finance a workforce. Request a waiver from the U.S. Department of Health and Human Services for the flexible use of SAMHSA monies over the next 3 years. And she can provide additional monies for each of the 4 DC prevention centers for more intensive community outreach education efforts. I am standing here and I want to thank a number of people. I want to thank all the members behind me who are part of the Opioid Solutions Working Group. The Opioid Solutions Working Group is made up of community residents, service providers, physicians, pharmacists, and others seeking opioid solutions from the ground up. We work with Live Long DC, and we welcome the input of those that are experts in the field. I also want to thank Inspire Media for helping to gather the media for this event, because this is an important event. The next steps that we are going to take is to request a meeting with the mayor. The next steps that the Opioid Solutions Working Group will make is to request a meeting with the mayor, sit down with her people to be able to suggest some of these things that she can do on the immediate side that would really address the issue and bring down the number of opioid deaths in the city. So right now, I'll take any questions before I introduce others who are going to speak. With me, I have people from the community, people that have been affected by opioids, people whose children have died from opioids, and they will be speaking to you as well. So I will take any questions at this minute.
You mentioned that you're asking for the executive order for the public health emergency for 18 months. Does that indicate that you believe 18 months is a good timeline to decrease these trends?
18 months is an initial timeline if the city enacts some of the reforms and some of the actions that we outlined that I outlined earlier. I think 18 months you will begin to see some effects if they implement these, and we're looking at a 6-month to 1 year implementation time period.
Sure. So the mayor has declared public health emergencies over gun violence, over the migrant crisis. Some of those programs, building blocks, haven't been built to scale. The Office of Migrant Services Office is not built to scale. How do you ensure that if she goes forward with this, that there is something behind this declaration?
Well, I think that, number one, we have to work together. Number two, we are very vocal. Our community is very vocal. We are suffering and our people are dying. And it's not just in Ward 7, Ward 8, it's all over the city. And with the introduction of xylazine, it's going to get worse. And so what the mayor can do is work with us, work with communities, even work through Dr. Bazran and Department of Behavioral Health to look at real solutions that can be put together right now. There are certainly things that can happen in the next 6 months that will start to reduce the opioid deaths.
Some of those sound like eminent domain. You're talking about like it seems harder to set up the scale. What could you like be more specific about what can happen within the next 6 months that could change and save lives?
Eminent domain is actually easy to implement. Now, if you're trying to use eminent domain to buy a $100 million building, no, then that's not necessarily practical. But we've identified some spaces where she could use eminent domain to actually put an adult residential treatment facility. It wouldn't cost the city more than $3 to $5 million in a bond.
Like a safe injection site you could open within the year.
No, a safe injection site is different. That's called a harm reduction center, and we need those too, because the evidence says that when you have a harm reduction center, a safe injection site, what will happen is that you have caring people and professionals that are around you so that if anything happens, they can take care of you. Otherwise, you might be overdosing by yourself. And in fact, many of the overdoses, particularly in Ward 7, have been alone, people that were alone and in their own residences.
I have a question about the link to crime. You're saying here that the heat maps of gun violence and these opioid overdoses and deaths overlap?
Yes, they do.
So can you just talk that through, the link that you're seeing between the gun violence in D.C. and this epidemic? And I also noticed that in the report, North Capitol and O Street seem to be a hotspot. What is happening in that intersection? What's in the area? Why there?
So there's nothing particular about North Capitol and O Street. It depends on where you go in the city where there are hotspots that are already designated. O Street is just one of the many hotspots that are in D.C. And near North Capitol and O, they put what's called a sobering center. And it's supposed to be coming online within the next, I'd say, month. They're going to be putting the budget, the mayor put in the budget $9.5 million for a second sobering center to be located in Columbia Heights. All of these areas need the infrastructure. But if you're looking at the raw data, the FEMS data, Federal Emergency Management Services data, in terms of where non-fatal opioid overdoses are happening, you really have to look at what's happening in Wards 8, Wards 5, and Ward 7 before you look at what's happening in Ward 1. So, I'm not going to say that that was misspent money because it's absolutely needed, but there are more resources that are needed to come east of the river. The only 24-hour hospital that deals with opioids is up in Tinleytown, and that's PIW, Psychiatric Institute of Washington. We don't have anything like that east of the river.
And the link between crime and these deaths?
So I was at a meeting that was actually put on, and I actually presented to Live Long DC. And there was a presentation from the Criminal Justice Coordinating Council and the ONE's office where they showed the heat maps of where the opioid deaths are taking place and where the gun violence and crime is taking place. And when you look at those two maps, and I have that in the council members' packets that will be given them. Those maps are virtually the same in every ward.
So what does that say about our crisis that we're facing?
That says that if you address the opioid crisis, then you also begin to address the crime issue and the gun violence issue. They're not directly linked, but they are intertwined.
What do you think of the mayor's Live Long DC initiative? I mean, it fairly seems like that's not doing enough if you're asking for a declaration more.
So the Opioid Solutions Working Group and the Health Alliance Network works with the Live Long DC program. We think that there are some things that are good, but we also think that it needs to be revised, and there are some things that need to be accelerated. They are going through a revision process right now, but some of the things that I mentioned are not in the revised version, and there's things that have to happen on an immediate basis if we really want to get at what's happening in our communities. And I want to stress not just the level of fentanyl penetration that you find in opioids, but now we are facing another crisis, and that is the introduction of xylazine on opioids. So you're finding where almost 25% of the needles are finding xylazine in the needles. And so when that happens, xylazine has no known antidote. And there are things that can happen as a result of xylazine. It's in our packet that we're giving to the council members. Absolutely, absolutely. I want to bring up former ANC Commissioner Kiki McBroom, and Kiki McBroom will share her story.
Good evening, everyone. Good afternoon, excuse me. And I not only have like 2 or 3 minutes to sit here and talk about the pain and what we need to do for our city, for our youth, but this, I hope, may not go past 2 or 3 more decades. And if I have to sit here 2 or 3 more decades to save a child, I will. My child was only 17 years old. Jayla McBroom was her name. There's no way that my child should not be here with me today. We would have to implement more programs. We would have to implement more resources in order to save these children's lives. As I'm sitting here today with you all, I'm sitting here and I'm watching these children walk up and down the sidewalk. In 10 years, if we don't get this stuff in place, a lot of these children may not make it because they will be introduced to something that may take their lives, like it took my daughter. I had no clue. I didn't see any signs of my daughter being a drug addict or anything of that nature. Somebody could have slipped something in her drink or something, or somebody could have introduced her to something, or simply could have been a pill that she could have taken maybe because she had a headache or something like that. We don't know how it was laced, but it's happening. If we come out here and educate our families to protect our children and let our children know what is going on, it can protect them. It can save their lives. You have it now where they're putting in candy and everything else. It is important that we must get out here and spread the word so we can save other children's lives. I do not want to continue seeing every day as I look online that someone else's child or family member has been taken from fentanyl. It's not fair. This is murder. This is absolutely murder. I was devastated when I woke up on June 22nd, 2021. I had to walk into my daughter's room to wake her up for school, and she was gone from fentanyl. It's not fair. I'm an advocate, an activist, an ANC commissioner. How could this happen in my home? How could my child have been introduced to something or given something that would have taken her life? My daughter was not suicidal. She would have never taken her life. She had dreams. She had visions. My child should not be a poster child for fentanyl. She had other things that I'm sure that she would like to have done, and she's not here to do that. And anything that we must do, I don't care how many times I must come out here to speak. I want people to understand that this is horrific for anybody to have to go through, and it's very painful. I wear black today because it represents death. I'm sorry. It's just too much. I have to go through this every day. Every day I have to relive the fact that my daughter's no longer with me. Easter just passed here yesterday. I don't have the opportunity to color eggs with my daughter if that's what she wanted to do, or eat Easter dinner with my daughter because she's on Suitland Road, 6 feet under, because somebody wanted to give her fentanyl. It's absolute murder. And again, we have to continue doing preventive measures. And I hear you talk about overlapping. How do gun violence overlap with the fact of drugs or fentanyl? It's going to overlap because people are making money off of this. Anytime people start doing criminal activities, they're going to overlap it into crime. If it takes them to take you out or do some type of physical harm to you, that's what's going to happen. This is the world that we live in. I'm in Southeast DC, Ward 8. Every day we have gun violence. You don't know what people are getting shot for or what is happening and what's the result of it all. But we do know that this all does overlap, and we have to come together and sit at the table and work together. This is the only way we're going to save our youth out here. Because right now what we're doing is just not enough. I'm not saying that we're not doing anything, because that couldn't be true. Because I have people behind me right now that are standing firm every week. They're having meetings consistently on Zoom, trying to figure out how can we save your child, how can we save your loved one, how can we continue educating our communities about the risk of fentanyl. This is not fair to us. My child, 17 years old, should never have come in contact with fentanyl. Never. And I'm angry. I'm angry. And so whoever wants to listen, the mayor, the council member, we have to take our city back. Our children deserve an opportunity to live past 17 years old. It's not fair. It's not fair to me. I can't go hug my child no more. She's gone. If Jayla was here today, and she had the opportunity to speak, she would tell you I was only 17 years old. And I would never took my life. She's innocent. She was innocent. My daughter was not a heroin addict. She was not a drug user. This is what they label our kids as. This is not my daughter. And I refuse to have her continue lying on my child. She went to school every day. She fought. She had a lot of issues she had to go through. We lived through a war zone. You have to continue to fight you have to fight every day. If it's the bullets running through your home, you're fighting from someone to make sure that you stay away from harm. We have to continue to get this word out. This stuff is it's so dear to me, and I'm sorry. I'm sorry. But this is real. So please, I am begging anyone that will listen. You know, when I ride down the street sometime, and for speeding and safety, you may see signs that say, act like your child live here and slow down. I want whoever wants to listen today to act like this is your child. Act like this is your family member that has been taken away. And I want you to fight the same way that I will fight for my daughter. I'm going to fight until there's no breath left in me to make sure that we will not continue to burn our children. This is not fair. And it shouldn't have to take for my child to be a certain color, for my child to live in a certain community, for my child to have a certain education, for somebody to be serious. Everybody's life matters. My child, again, was only 17 years old. It was introduced or given or laced with fentanyl. So if Jada was here today, I know Jada would say, continue to fight, everybody.
Absolutely.
Continue to fight.
Absolutely. Absolutely.
Save my peers. I have children that have called me today because they know about my daughter that would not touch another thing because of the fact they know their friend is no longer here. They would not touch a drug. They would not touch an alcoholic drink or anything because they're going to live it out for my daughter. They would not take anything from anybody. You cannot take anything from anyone, not for a headache or anything, because you don't know what it's laced with. And that's my message. Please continue to support these organizations and whomever feel like they have something that will come to address or to present to our communities and educate our communities about this situation. And we must stand behind each other. We must work together. Like you said, Ambrose, we have to work together. public safety is everything, and fentanyl is included.
This is an example of the pain our communities are facing with opioids, fentanyl, xylazine, poverty. This is the trauma that our communities face. And we need the city to step up and issue a public health emergency on opioids because we are enduring pain. Next, we have Anna Jones.
My name is Anna Jones, and I'm a woman in long-term recovery. And what that means for me is I haven't picked up a drink or drug since August the 30th, 1999. Because of that, I get to stand here in front of you today as a mother, as a daughter, and as a person that's honored to be working in the field to try to save lives. As a person in recovery, we hear all the time in the rooms, right? The 12-step rooms, keep coming back, keep coming back. But it's not like that today. It's one and you're done. One and you're done, right? This thing is no joke. Listening to Ambrose talk about it being DC being #1 above West Virginia. Our people are dying. This is an emergency. I'm also a daughter of a mother. My brother passed away of an overdose, right? He was an IV drug user and he passed away of an overdose. At that time, there was no Narcan or anything to save him. And my mother had to come and find her son in the bathroom. Today we know we have the Good Samaritan law, right? We need to talk more about that, where if you find someone who is, is overdosing and you don't have Narcan or anything, you can call the DC police and they won't lock you up. Back then, if you called, that was harm, you get locked up. So we need to spread the word also about the Good Samaritan law. That's very important. I'm also an outreach coordinator, senior resource coordinator. I'm here with my outreach coordinator, Mark Spence. Very emotional right now when I talk about this. But we do recovery housing for people who are recovering from OUD, right? So we need to spread the word about that too, that there is help. I also have young nieces and nephews who are out here experimenting. And we heard Ms. Broom just talk about the one and you're done. They're not in recovery, they're just experimenting. This is scary. This is an emergency. We need help. Everything that Ambrose talked about needs to happen, and it needs to happen right away. Through God's grace and mercy, I stand before you today because I know it could have been me, because that was me walking homeless, just doing anything to get the next drug. But today I can be here and not be anonymous, but be honest about what's happening and be in the solution to help and save lives. I am asking you, we're doing a DC Recovery Town Hall, and that will be happening tomorrow. You'll hear from a number of members in the recovery community to identify the priorities of the DC recovery community in 2023. We're asking for all decision makers, change agents, and advocates to please come and support. This will be via Zoom. It is a recovery town hall meeting to talk about the issues and the opioid crisis that's happening in the District of Columbia. We need your support. Please come out. Thank you.
Next, we will have Reverend Curry.
Good afternoon. I'm Reverend Karen Curry from the Pennsylvania Avenue Baptist Church. I am here on behalf of our pastor, Reverend Dr. Kendrick Curry, And here representing also those of us in the faith community. There are a number of churches and clergy and people of faith that we have been working together, particularly in Wards 7 and 8, to address this issue. Psalm 107:6 says, "They cried to the Lord in their trouble, and he delivered them from their distress." As people of faith, certainly we are crying out to the Lord for help, but we're also looking and appreciating all who can help with this issue, because we know that faith without works is dead. So I do want to thank those of you from the media for helping to get the word out also to the public, because everyone thinks that this is a problem somewhere else affecting someone else, but this is all of our problem, because at any moment we could all be directly affected. And so because of that, the Pennsylvania Avenue Baptist Church supports the call for declaring opioid abuse a health emergency. We at the Pennsylvania Avenue Baptist Church have seen the ravages of the opioid epidemic firsthand, as our church is located in Ward 7, a hotbed of opioid abuse. Deaths and overdoses have touched us up close, and despite our best efforts, the tide appears to be growing. For over 5 years, we have addressed this heartbreaking epidemic head-on, partnering with Howard University Hospital, the DC Dream Center, the Ward 7 and 8 DC Prevention Center, Prestige Healthcare Resources, and many churches to provide awareness and effective treatment. Our efforts have literally saved lives. Yet, for every individual we help to get free from the grips of this ghastly addiction, there seems to be an exponential increase in the number of persons succumbing to opioid and substance use disorder. We and our partners know that intervention and treatment work. The only thing that doesn't work is the shortage of resources to address the issue long term. Opioid addiction is a long-standing issue that demands investment in long-term solutions. The number of full-time, fully compensated, fully trained peer recovery specialists is woefully inadequate for the task at hand and must be increased urgently. On behalf of the grieving families we are still ministering to, on behalf of those DC residents whose lives have spiraled out of control, on behalf of our city, which is missing out on the contributions of some of our best men, women, and youth, we are pleading to declare this crisis the health emergency that it clearly is, and help us expand critical access to treatment and support. The particulars regarding treatment and support may remain to be decided. However, it's painfully clear that more resources for awareness, intervention, and treatment and support are urgently needed. Thank you.
We'll now have Larry Bing.
Good afternoon, everyone. My name is Mr. Larry Bing, Sr. I am what they describe as a prevention navigator. I work for an organization called Leadership Council for Healthy Communities. I also work with the telehealth community every day. I see addicts every day. We have 2 to 3 minutes to make vital points. I was just looking around. We're standing before one of the greatest buildings in D.C. with all our officials in it, and we can't even get an audience with them. We can't even get an audience with them to discuss what's important. And what's important, the 2 things that I want to point out, is that we need to stop giving out generic medications to get rid of a disease, which is the fentanyl. You cannot start a community on a drug such as Suboxone that was original in its nature, and because it's cost effective for the insurance companies and the pharmacies to make money for you to give these things to addicts. You wouldn't give somebody that was a diabetic generic medication, would you? The second thing is housing. Our communities are full up. I represent, as I stated before, clients who are addicts. We have 3 hotels throughout the city that are full up with homeless people who need housing. We are fixing streets. We are bringing in eateries. You cannot tell me that the money that we make from photo tickets, parking, etc., that we can't find housing for the people that vote for these people in these buildings to represent their communities. It's shameful. We are in the nation's capital, and we have homeless people who should not be homeless in this city with all the capital that we have. Look around you. Look at all the eateries. Look at how they fix the streets. When are you going to take some money and give it to those who are dying? As the lady was up here earlier, she just told you about a 17-year-old daughter. She's gone. As much as I try, my wife and I work with this community every day. I've lost clients to fentanyl because they come to me every day, every week, crying about the generic Suboxone that does not help. It does not help against fentanyl. If a client gets 28 for a week, that's 3 to 4 days. On the generics, they might have to take 5 to 6. If they were getting the original dosage, 3 would suffice for a 21-day supply for 7 days. I work with a doctor that they won't even talk to who is experienced with this. Earlier, Ambrose Lane was up here with raw data. I often say that I'm glad I'm supported by people who understand stats. Dr. Edwin Chapman been doing this over 23 years. They know about him. They won't even invite him to the table to sit down to discuss what is needed. What is needed going forward. Dr. Edwin Chapman. Ambrose Lane knows him. The people behind me know him. These people in this building have heard of him. He can't even get an audience. How is that possible? Thank you. I hope, again, I've been down here before. I was telling somebody earlier. I've been here before. I've also been on Capitol Hill. I haven't seen any changes. Change comes slow in the District of Columbia, as we well know. And I truly hope that the mayor sees this and invites Ambrose Lane and the people behind me here to come down so that we can come up with solutions for this opioid crisis, because it is a crisis. And as he stated with the data earlier, you have more people dying from overdoses than you do from murder. Thank you.
Thank you, Larry. Rhonda L. Johnson.
Good afternoon. My name is Rhonda L. Johnson. I'm a native Washingtonian. I am the CEO, author, certified peer specialist for the Now Hope to Reality LLC certified business. I'm also the founder, visionary, and lead organizer for the DC Walk for Recovery walk and vendor event that is scheduled to take place on the National Mall Saturday, April the 29th, 2023. Question, by a show of hands, how many of you remember when Washington, D.C. was known as the murder capital of the world? Well, I am a survivor of the crack cocaine epidemic. I remember when there was no system of support for those suffering from drugs, despair, and no hope from the crack cocaine epidemic that made sense to help and assist families trapped by drug crisis. There was no empathy for a demon that took siege of our city. Now, the new demon from the opioid fentanyl crisis is causing chaos and is being treated as a silent epidemic, so that the new gentrification city of Washington, D.C. does not look bad. My question to you today is this: is this a black versus white epidemic? What we have learned from the crack cocaine epidemic is to help those suffering from the opioid fentanyl crisis. How many residents have to die before the city understands we are under siege again? For if we do not treat this as an epidemic crisis, then Washington, D.C. better get ready to become known as the new
Wild West, death capital of the world. Thank you very much.
I greet you all with peace. My name is Asia Tamimi. I have an organization called Rock Now Incorporated, and it's geared towards alleviating with the recidivism rate through educational programs, as well as offering life skills courses to those who are at risk to gun violence. You asked, how does it overlap? The crime and the opioid addiction crisis, because when you're dealing with a person who is suffering from an addiction to an opioid, by any means, they're trying to get a fix. By any means, they're trying to curtail that pain that they're enduring because they're sick and they're ill. So some of us may become their victims just to satisfy that urge or that need. And the sad thing is that PIW, being the only place in DC that offers 24-hour care in DC, is sad. With my program, my life skills program, the majority of my students who are in my program are suffering with opioid addiction. This is how they're pacifying the pain and the hurt that they have from seeing their loved ones and their friends murdered in front of them. This is how they pacify it. This is a crisis. Last year we had 200 and something murders in DC, a little over 200, but we had over 2,000 overdoses. Shakita McBroom is my friend. I was there with her when they took her daughter out of the house. I saw the pain and I see it every day. It's not a day that goes by that I would trade to have her daughter back here with us. Beautiful young lady, sweet, honestly. And like she said, under no circumstances would she ever want to take her life. This is a crisis. Something definitely needs to be done about it. I see it really getting out of hand and really quick. Look at what's happening in Virginia. Look what's happening in Maryland with kids overdosing in school. I think that every staff member in the school should be properly trained on how to give Narcan. Thank you.
As I mentioned earlier, and I want to introduce my wife, Dr. Nora Green Lane, who also works for the Ward 7 and 8 DC Prevention Center and does work in the opioid space. Did you want to say something?
Yeah. Recuperating. I think that I agree with my sisters back there that we need to provide the training and the resources, especially around prevention. Prevention is always the last thought, but prevention is the one that saves us in the beginning, and it saves us a lot of money. And so when we put more money towards prevention, we reduce the need to have the extremes of resources being used in our emergency departments. This is where a lot of people go to get some kind of service, but it's not the right place and space, and oftentimes they're not always treated the best. As community members, as a daughter of a person in recovery for 30 years, it affects all of us. It affects the children, it affects the loved ones, and those that are lost through this. And we need to really address mental health, and especially among our young people. We can't wait until our people are in high school and college. They suffer in elementary school, and so we need to be able to provide those behavioral health supports, not reduce, but increase, and really show people how to cope with life. Life is difficult, but sometimes we don't always get the right resources. And so we really need to work hard at ensuring that the resources are properly allocated and equitable. That means that everybody who needs it gets it, and especially in the worst places and spaces, so we can do a better job of really servicing all people. Thank you.
I just want to say again that the opioid epidemic is almost as bad as the COVID epidemic. The opioid epidemic is almost as bad as the COVID epidemic. Again, from March 2020, when COVID began, to December 31st, 2022, there have been 1,400 and 11 COVID deaths, but 1,219 opioid deaths during the same period. It is an epidemic, and we are calling on the mayor to issue a public health emergency on opioids. That concludes our press conference. At this moment, we will be going inside the Wilson Building in room 104, where we will be briefing members of the council on the opioid crisis and what needs to be done. Thank you very much for coming out. Thank you all. Thank you all. I know you're caring right now. It's all right. Listen, everybody who wants to go up.